Good morning, everybody. Good afternoon for those of us in the East. My name is Katie O'Shea. I was honored to do program development at the Rising Sun Treatment Center in Attawahanaig First Nation in New Brunswick with the theme of healing and recovery for people living with substance use addiction. So I'm a white settler of Irish, Scottish, and Belgian descent, and I'm presenting to you from unceded Mi'kmaq territory in Miramichi, New Brunswick, where I live, work, and play. We're on the northeastern shore of the province in Atlantic Canada. New Brunswick is home to the Mi'kmaq, Wolastoqey, and Passamaquoddy peoples. I'm a nurse by trade. I'm a new mama to a 5- and 6-year-old, my bonus babies. I've worked in community health since I graduated from nursing school. I was a community health nurse in northern BC, and now I work with the Tribal Council in New Brunswick on the Jordan's Principal File. I feel really strongly about social justice, about wraparound services, and about working in community. So the Rising Sun Treatment Center is in Attawahanaig First Nation here in New Brunswick. I had the honor of working here under the incredible guidance of Cheyenne Joseph, who's the executive director, and the staff that work there. I was immediately adopted into the family, the Rising Sun family, and I say family for many reasons, but a perfect example is that when Cheyenne sends email to the staff, she literally addresses them, "Hi, Rising Sun family." Working with Indigenous nations as a settler woman, it's influenced me in many profound ways. The biggest lesson being that relationships are everything. Relational care, relationship-based practice. It's just absolutely incredible. It's hard to describe sometimes maybe what that's like. The health center that I used to work at, there was a quote on the wall, when we change I to we, even illness becomes wellness. And working at the Rising Sun really just brought home that lesson of the relational care and that need for relationships. So I did a part-time practicum. I started in September. My goals were to become a team member of the Rising Sun, to research wise practices in addictions rehab service delivery in order to inform program development at the center, and to apply evidence to practice. I learned many, many things, both informal and formal, including the landscape of rehab service delivery. I became part of an organization. Like I said, I built relationships with really incredible staff, and I'm so grateful for each and every single one of them. I participated in strategic planning. So the Rising Sun has delivered residential-based services for 30 years since the center opened. And because of COVID, the center had to adapt the way that services were delivered. So they went from providing residential services to then providing a digital program, a telehealth-based program, as well as a day program once restrictions opened up a little bit here in New Brunswick. Also, the strategic plan was up as far as the development of the center. So I got to participate in the strategic planning kind of from when we got the consultants in up until making the plan for the 8 months that I was there. I also received some really incredible public health leadership from Cheyenne. She's just such a strong, fearless leader, and I learned a lot of lessons from her. This picture actually on this slide, this is the view from my window in my office. You can kind of see my desk there in the background. Beautiful view. Excuse me. So my research methodology was based on the needs of the Rising Sun. There was things that the Rising Sun already knew as far as the practices on their day-to-day. So culture is the foundation of the center. So I didn't do any research based on culture as healing just because that was stuff that the center already knew. So the point was to do research that was relevant to the program development at the center. I started with a scan of the research, focused on themes, compiled a summary, and then with the plan to present it to the staff in both a research summary as well as an infographic. I used databases, various web searches, community-based resources like the Thunderbird Network, collaborated with a local treatment in one of the health authorities. And as I would learn new concepts or explore new themes, I got to go and talk to the addiction counselors about them kind of in real time, as I was learning new things. So it was really incredible to be able to translate that research really into practice by consulting with the addictions counselors. Many of the staff at the Rising Sun live in recovery as well. So not only are they living in recovery on the day-to-day, but then applying this with their staff or with the clients every day. So that was a really cool experience. And then I compiled the research in a way that was relevant to the staff. And it's funny, the first time I presented my draft to Cheyenne, she very sweetly, it was an academic paper. It was APA'd, it was very technical. It was very very detailed. And she kind of laughed and said, this is a great start, but now you need to present this in a way that's relevant to our organization and to the staff. And then the infographic was, infographics are supposed to have pictures, and mine just turned into, I'll show it in a couple of slides, but it ended up just being kind of a visual summary of the research, just because there was so much content and so many different themes and information to present. So the point of having the visual research summary, the goal was for staff to be able to put it on their bulletin board, so that when the program development was happening within the strategic planning and as the center was moving forward, staff could refer to that information that was available through the research that I had done. So before I get into the details of my research summary, I'd just like us to take a quick pause just for a few seconds and just to reflect on any stigma or biases that you may have related to addiction, or that you may associate with people who experience harms from substance use. Did you notice the language that I used? I didn't say addicts. I didn't say substance use disorder. I didn't say substance abuse. So much of the research talked about stigma, the stigma faced by people who use substances. When people want to access support or treatment, there's so much stigma. Stigma can prevent people from reaching out for support. I had thought I was conscious of my languaging, in my public health practice, coming from a person-centered, trauma-informed lens, but Cheyenne really helped guide the way that I presented the information. And when I had researched how you can overcome some of the stigma related to substance use, a lot of it talked about languaging. How we frame things, the words we say, the phrases that we use are really incredibly important. We need to humanize the issues. People who experience harms from substance use, they can be our neighbors, our friends, our family, our loved ones. So when presenting the research, I was really conscious of the languaging that I was using, and I challenge you to consider the way that you use your language and the way you speak about substance use in the future. So this is the research summary. This is the visual summary. I'm definitely not going to go into it. It's obviously there's a lot of information here. I'll just give some highlights, but I really love the experiential learning from the research. Simultaneously, I was scanning research and then working with staff, working with clients, just seeing real-time adaptations from the center, as they adapted to the needs of the COVID, the pandemic adaptations. And then with the new programming and with the strategic planning, it was a really cool experience. So just a few highlights. Recovery journeys are really individual to the person. They depend on the person. They're unique. Intervention timeframes vary. There's no real formula for recovery. Even the word recovery, before I had this practicum, I don't think I would have ever used the word recovery as to talk about people's recovery journeys as they go through their life. So another big thing is trauma-informed services. Services should be approached from a trauma-informed lens. We talk a lot about trauma-informed, we hear a lot about trauma-informed, but it's not just the way that we interact with clients. It's also in the way that we do our intake procedures, in the way that we set up the physical spaces that we provide these services. Just so many little considerations about the way we're delivering services. So focusing on the languaging, humanizing the issues, making sure that people are in control of the decisions that they're making with regards to their recovery journeys. And supporting women. Women have lower rates of access to treatment services due to many intersectional things, including often being the primary caregiver for their babes, access to childcare. It's really difficult to leave your family for 30 days to come and experience a residential treatment program. Women have an increased risk of violence, increased risk of housing insecurity. Women experience increased stigma when they're accessing services, especially pregnant women. So there's a lot of things that I didn't touch on, obviously, just due to time, but this will all be in my final paper if anybody's interested. I just would like to acknowledge the Rising Sun staff. Walalio, thank you so much. They let me in, they welcomed me, they supported me, they loved me. Thank you for having me, thank you for teaching me. Cheyenne, thank you so much for taking me under your wing, for demonstrating leadership from a community-based, inclusive, collaborative way, for being such a strong, powerful force in your soft-spoken way. Fun fact, I did my nursing practicum with Cheyenne years ago in Nattawahaganeg as well, in a different capacity, in a mental health capacity. So it's been really cool to come full circle and be able to be with her through my public health practicum as well. And just to conclude, thank you everybody for your time. Thank you to all my fellow presenters for all your hard work. These have been absolutely incredible presentations. Thank you to the faculty for your support, Nigel especially. I'm grateful. Thank you all. Walalio, Umsit Nogama, all my relations.